Chapter 2, quality assurance and legal issues in healthcare. Again, this isn't really something that we're going to be too worried about. Okay, moving forward. Oh, that's not the right clicker. Okay, so quality is defined as the degree of excellence in something. And quality assurance is defined as all activities and programs put in place to guarantee the excellence of patient care. The Joint Commission establishes standards for the operation of hospitals or health-related services and facilities. The mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel, in providing safe and effective care of the highest quality and value. We made it through. We made it through that paragraph. So the Joint Commission monitors all healthcare facilities. They come in and they do tests, okay? They make sure that we're following policies and procedures. They make sure that the employees are aware of policies and procedures and where to find things like fire extinguishers or fire alarms, okay? They make sure that they know your evacuation plan, okay? They come in and they test you on these things to make sure that we are following the policies and procedures they have put in place with the hospital. Patient safety and Sentinel events. Sentinel, or early warning event policy, is to help healthcare organizations, or HCOs, identify significant safety issues and take steps to prevent them from happening again. A Sentinel event is any unfavorable event that is unexpected and results in death or serious physical or psychological injury, which is, for example, loss of limb, loss of life, okay, or any of its functions. So if someone loses a limb in our care, we want to know why it happened, how it happened, and what we can do to prevent that from ever happening ever again, okay? If a Sentinel event occurs, the healthcare organization is required to perform a thorough and credible analysis of the root cause. They launch an investigation, okay? Who was there, what happened, who did what, okay? Who administered what kind of care. They develop an action plan and then implement improvements to reduce the risk of the practice. Monitor improvements to determine if they are effective. So they make a plan. They say, hey, this is what we're going to do to prevent this from happening again. We're going to implement these improvements to our policies and procedures and see if it helps. Okay, once we start implementing these improvements, we're going to monitor them for X amount of time, okay, and then we're going to log everything as we're doing it. National patient safety goals are used to promote and enforce major changes related to patient safety. So, going into kind of our big one that we're going to be focusing on when we're dealing with patients, how to identify patients correctly. And those of you who have worked in healthcare before know that it's very important that we identify patients correctly. So, we are using at least 2 ways to identify patients. Name and date of birth. At the very least. Okay, name and date of birth are going to be the things that we identify patients with at the very least. So after that, it's patient ID number, and most things are electronic now. So after you say, can I get your name and date of birth? We need a out loud statement of their name and date of birth, and then we can scan their ID band with our electronics that we use. And then we need to make sure we label all blood containers and other specimens in the patient's presence, okay? If you leave a room with unlabeled specimens and you go into the next room to take a blood draw the blood, bring the blood back to your tray, now you have a bunch of different tubes that are unlabeled. How are you supposed to know which tube goes to which patient? Even if you know, how are you really supposed to know? Do you know what I mean? So we need to make sure that when we're taking blood from patients, we're labeling in the patient's room so that we've got, hey, I've got Joe here, first and last name, date of birth. It matches up with the label I have. I just took this vial of blood from him. I'm putting the label on it, and now I know for a fact this is his blood because I'm in his room. I just took his blood. I confirmed his name and date of birth, his ID number. We're good to go. okay? Protect yourself as well. It protects the patient and it protects you. If you make a mistake, people can die, okay? Or become seriously injured or ill, and you will get in trouble for that. It's negligence, okay? Pay attention to what you're doing. Label your specimens in the room. The objective is to reliably identify the individual and match the service or treatment to him or her. Improve staff communication. Get important critical test and diagnostic procedure results to the right staff at the right time. The objective is to report critical results to the responsible caregiver within an established time so the patient can be treated promptly, which means that if a test is stat, it needs to be done stat, okay? We need to pay attention to these things. If there is, for example, a test that is supposed to be taken at a certain time, we make sure that we go and we get that test at that time so the results can come back to the nurse or doctor at the time that they need it to, okay? This all affects patient care, right? If something is stat, for example, a patient needs a medication but they're unsure when they need to get it, they take a blood test to see when they should administer this medication, but then the results don't come in for however many hours and that patient passes the time they can receive that medication, whose fault is it? Okay? We need to make sure that we're paying attention to stat orders. We need to make sure that we're getting results in a timely manner for tests that need it. Prevent infection. Use current hand hygiene guidelines from the CDC or World Health Organization or WHO. Set goals for improving hand hygiene and implement them. The objective is to reduce transmission of infectious agents from staff to patients and decrease HAIs, which is hospital infections, hospital-acquired infections. We all know how often we need to be washing our hands, okay? And for how long. Make sure you're washing with warm water for at least 20 seconds. Tops, bottoms, in between the fingers and under the fingernails, right? Okay, make sure you're wearing gloves when you're supposed to. Make sure you are hand sanitizing in and out of every room or before and after every patient. If you're in a plasma center, you'll hand sanitize, put gloves on, go grab a patient, set him up, do everything, take your gloves off, hand sanitize, put gloves on, go get another patient. Okay?
Are you talking something different than washing your hands?
Hand sanitize, yeah. So we're gonna be hand sanitizing a lot. Hand washing is it's still a lot, but it's not as often as hand sanitizing. So for example, if you're at Luke's, how it works is you go in and out of rooms, patient rooms. So you would hand sanitize before you enter the room. Once you're in the room, put on gloves. Then you can do your job. After you take off your gloves, when you're finished with the patient and finished touching your specimens, you hand sanitize. Then you leave the room, go to the next room, hand sanitize before you go in and do it all over again. So you're hand sanitizing in and out of every room or in between every patient. Then I would say, so my kind of little routine that I had going when I was doing this was I would do like 5 rooms, hand sanitize in and out, and then after the 5th room, I would hand wash and send my blood. Then I would do 5 more rooms, hand wash and send my blood. Does that make sense? Just to have a little routine, make sure I was getting my hand washes in, because hand sanitizer doesn't work for everything. If you get your hands visibly soiled by something, you need a hand wash, okay? Hand sanitizer is only for if your hands are not visibly soiled. And we'll be working on that in here too. I have hand sanitizer back there, and I'll keep the lab open for the hand wash station. If you, for some reason, get blood on your skin or on your hands or anything like that, we'll be hand washing, okay? Additional agencies are the Institute for Healthcare Improvement, which works with countries, regions, organizations, and individuals to build safety into every system of care to ensure that patients receive the safest, most reliable care throughout the healthcare industry. And the Clinical Laboratory Improvement Amendments of 1988, which we talked about a little bit, or federal regulations that establish quality standards and apply to all facilities with the aim to ensure accuracy, consistency, and reliability regardless of location, size, and type of lab. Okay? All labs everywhere follow CLIA 88 so that we have consistency and stability in our testing. Quality assurance in phlebotomy is super important. QA processes, appropriate process improvement techniques to identify problems or inadequacies and make changes to prevent errors. Quality indicators are a measurement or value that provide information on the effectiveness or quality of processes. Thresholds and data. Threshold value is a level of acceptable practice beyond which quality patient care cannot be assured. Process and outcomes, following processes from start to finish to monitor the outcome and ensure the same process is always followed. And quality control, or QC, the use of checks and controls to assure quality. And we'll talk about this more as we go through the rest of the slides. Areas of phlebotomy subject to quality assurance, okay? Patient preparation procedures. To obtain a quality specimen, the patient must be prepared properly. This is where patient identification comes in, okay? Our quality assurance, or our check and balance for ourselves, is patient identification. So the most critical step and quality assurance for us is patient identification. We need to make sure that we are asking for name, date of birth, and then scanning their ID number to make sure it's them, because it's not impossible for people to have the same name, okay? John Smith, how many of those do you think there are in the world? A billion, okay? Sometimes you can have someone with the same name in the same hospital, and you'll get name alerts that pop up like on your screens and stuff. You'll get name alerts, or there will be like little tags or something like that that tells you that someone else has the same name. So what would we check next? Their birthday. Do they have the same birthday? Probably not, but it could happen, right? It's not impossible. Then we're checking their ID numbers. Puncture devices, okay? We're making sure the quality and sterility of every needle and lancet is essential. Ensuring the quality and sterility of every needle and lancet is essential for patient safety. So we need to make sure that if one of our supplies is in a plastic case, okay, it's a one-use item that's supposed to be sterile, we're not opening it ahead of time and just letting it hang out willy-nilly in our pocket, okay? We're keeping everything as sterile as possible. We're checking our needles for barbs. We're checking our needles for bends. We're checking our tubing to make sure it's not leaking anywhere. We're checking to make sure that everything we're using is one-use sterile, not been opened yet, okay? To make sure that we have patient safety. We're checking our expiration dates and disposing of outdated evacuation tubes, okay? Because that can affect results. Quality assurance, we're checking and balancing ourselves. Checking our tubes to make sure that our seals are not broken, that we have the right expiration date. In here, when we're practicing skills, a lot of our stuff is donated to us, so it's gonna be expired and stuff. That's okay. In real life, when we're dealing with patients and when results are very important to care, we need to make sure that we're checking expiration dates every day, every time we use a tube. Labeling must be exact. It must have patient's first and last name, birthday, ID number. Everything's electronic now, but it will also have your name, the date and time it was collected, and then if you feel like it, your initials afterwards, okay? Technique, maintain standards of good technique to ensure high quality specimens. This just means that we are following our policies and procedures, the procedure for venipuncture exactly, so that we are cleaning the site for the correct amount of time, allowing the site to dry for the correct amount of time, not touching it after it's been cleaned, okay? Not re-poking with a used needle, okay? When we're doing skills, and I'm gonna talk about this when I do my example poke in a couple of days. If you're nervous, okay, you pull your traction and you poke the skin and then withdraw because you get scared, and then you poke again, it's a no-no. We poke one time with a needle, and the only reason I say that is because I've seen it happen. And I was too slow, so it was my fault, okay? I was too slow, and I guess I didn't say it before it happened. But if for some reason you accidentally poke a tiny bit but don't follow through, do not poke again, okay? We poke one time use needles only, okay? Make sure we're using proper technique to poke. That way we're not compromising patient safety and or our own safety, and compromising the sample at the same time. Okay? Collection priorities, recognizing which specimen request is the most critical, or when a specimen involves special collection criteria. Now, this could be, does the specimen need to be protected from light? Does the specimen need to be placed on ice? Does the specimen need to be collected without a tourniquet? Okay, does the tube need to be warm before the blood is drawn into it? Okay, special collection criteria. Sometimes we'll take tests that need to be drawn at, so for example, we need to take a glucose test, okay? The patient drinks the glucola, and then we take a glucose test 1 hour, 2 hours, maybe 3 hours after, but it's all timed and it has to be exact. Okay, so we pay attention to those things. Is this test stat? Did it just pop up? Is it stat? Do we need to go to that first before we go to this random one? Okay, we have to pay attention to all of these things and make sure that we are collecting the specimens in a timely manner at the right time so that we get the results at the right time. Make sense? Questions? And then we have our delta checks. Delta checks compare current results of a laboratory test with previous results for the same test on the same patient. Okay, so we will do delta checks on patients sometimes when we're trying to establish a pattern, right? So we take a test, we get the results. We take the same test on the same patient later on, we get the results, and then compare the two. Then we take another test, get the results, and compare to the first two. These are our delta checks. It's how we monitor patients throughout their stay. Documentation. Documentation is critical in all areas of healthcare. Medical errors due to wrong information are prevalent and sometimes deadly. The patient's record is a chronological documentation of medical care given. I would document everything you do when you're in a patient room, okay? Because guess what? You're not the only people who go into the patient's room. You have nurses and doctors and all sorts of different medical personnel going into the room, and if something happens to that patient or if something goes wrong, they're going to question everyone. They're going to look through the chronological order of events that happened to this patient to find out what went wrong. Okay? And it's for very special circumstances, like if someone makes a mistake. For example, one time I left a tourniquet on a patient on accident. That's a big no-no. Okay, it was when I was still really green. Total accident, but it's very dangerous to do that. Okay, and I got in trouble. They had to look back and see like who was in there. They questioned everybody to find out who did it. And here's little old me like, I'm so sorry, it was me, I did it. Please don't fire wait. So it's important to pay attention to these things. Okay, make sure that you're documenting everything that you do. Legal issues in healthcare, sexual harassment. We all know what it is. We all know why it's bad. Okay, don't do it. Persistent or offensive conduct related to a person's sex that negatively affects a person's job. I shouldn't have to have the conversation with you about why sexual harassment is not a good thing. Okay, you guys know, you are adults. It is what it is. Also, don't be afraid to speak up against sexual harassment happening to you. Okay, because it will happen with patients. Okay, so if you feel uncomfortable, you don't have to stay in a room you don't want to. Okay, also don't put yourself in a position to be blocked in with somebody. Okay, pay attention to the patient, pay attention to your surroundings, pay attention to where you are. Patients can be a-holes sometimes, okay? Tort, a wrongful act committed against someone's person, property, reputation, or other legally protected right. This includes assault, battery, breach of confidentiality, fraud, invasion of privacy, malpractice, and negligence. Okay. We just don't want to commit any of these things, okay? You can be charged with assault and battery if you do something without someone's consent. So make sure you're paying attention to that. Make sure you get the consent that is required for you to perform your job. If you go into a room and ask someone if you can take their blood and they say no, that's okay. Totally fine. Not your problem. You could just say, okay, great. I'm going to let your nurse know that you're refusing, and they'll be in to talk with you about your options. Okay? You don't have to get blood on somebody. If there's an order, if they say no, everyone has the right to refuse, and that's okay. Do not breach confidentiality. okay? And make sure you're paying attention to the things you're doing. Negligence, like leaving a tourniquet on somebody, is no good. You get in trouble for that kind of thing. So make sure you're paying attention to things that are as small as that, okay? And it can be as simple also as like, I don't know, leaving trash or caps or something in a patient's bed. What if it's a kiddo, a 2-year-old, and they don't know and they choke on it, okay? Make sure you're paying attention to these things. Patient consent is huge, 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 important. Okay, we need to make sure that we're getting consent. Informed consent, voluntary and competent permission for a medical procedure, test, or medication. This means you've come in and you've said, hi, my name is whatever. I'm here to do this. Is it okay? Yes, awesome. You've told them what you're gonna do, why you're gonna do it, who you are. You've informed them of everything they need to know, and they give you permission, okay? Express consent is a variation of informed consent, usually for surgeries, experimental drugs, genetic testing, or high-risk procedures, written and verbal. So they've expressed their consent on a piece of paper that says, we're gonna do this, we're gonna do this, we're gonna do this. This is the criteria. Are you okay with this? Okay, we are not liable. Then they sign away their soul. Okay, they sign a piece of paper that says it is okay. Implied consent is the patient's actions or circumstances imply consent, CPR, okay? Someone is unconscious on the ground, they need CPR, you don't know anything about them, they just need help. That's implied consent, okay? They don't need to verbally give you consent. Another form of implied consent and something that you guys will experience, something pertaining directly to phlebotomy, you go in and you ask a patient if it's okay if you draw their blood and they don't say anything to you, they don't look at you, they don't open their eyes, they just go like this. Okay, that's implied consent. If they hold out their arm for you, you know you're good, okay? If at any time during any of these consent is withdrawn, you gotta stop, okay? For example, I went into a room one morning of a really old guy, okay? And usually he's very nice. He was a little cranky this day. So I went in and I said, hey, good morning. I'm here to take your blood. Is that okay? I explained to him what was happening and he said yes. I tied the tourniquet on him, okay? I scrubbed in. I pulled traction, uncapped my needle, went to poke, and he said, if you poke me with that needle, I will knock you down. And I said, oh, okay, sorry. And I popped the tourniquet and I said, what happened? You told me I could. And he said, actually, I changed my mind. And I said, okay, no problem. I'll go get the nurse and we'll come back in and have a conversation with you about your options. So we did. And then he said, fine, and he let me do it. Okay, but I was getting ready to poke. I was almost to his arm and he said, don't do it, okay, no. So I pulled the tourniquet off and I said, okie dokie, no problem. Even though it was very irritating for me, okay? It happens sometimes. People will give you give you the go, and then they'll say, actually, no, just kidding. Okay? That'll happen too.
If you're in the middle, like, of you already are starting to poke them, and they say you just pull out and continue also, like,
correct.
A nurse, like, the same thing.
Yes, and also you'll have people who say, ow, it hurts really bad, you're done.
Okay, and then you just...
And you just say, okay, pull everything out, and you are done.
Okay.
It's just hard to deal with patients because you have patients who are so nice and who will be like, you can draw my blood like as many times as it takes, especially if you're new, right? So if you're new, you know, they'll say, it's okay. Like if you miss the first time, they'll say, it's okay, here's my other arm, go again.
Yeah.
Okay, or you'll miss and you'll have someone who says, yeah, you're done, no more. You're not touching me ever again. Okay, so it's two sides of the spectrum and you get a little bit of in between as well. So, but if at any time somebody says no, or you're done, or please stop, or you're finished, just end the procedure and go get a nurse. Correct. Consent for minors. A minor cannot give consent. Parent or guardian consent is required. If there's no parent or guardian in the room, okay, you're getting a nurse. Okay, and this kind of stuff is going to be pertinent for only Lukes and Owls in clinics, okay? You're not going to see minors or kiddos or anything, or like super, super old people. You're not going to see those ages in plasma centers and stuff like that. So these are only for when you're dealing with kiddos, obviously. And then refusal of consent. Any individual has the right to refuse treatment for any reason. They must sign a documentation of refusal form, okay? So that's the other thing. If someone refuses, they say, no, I don't want it. You say, okay, I'm gonna go let your nurse know so we can get the paperwork for you to sign documenting that you've refused our care, okay? That way, if later something happens where you needed this blood draw and we didn't get it, we know why. Usually then people will be like, okay, fine, just do it, okay? So I've had patients who have said, no, I don't want you to draw my blood. And then I say, okay, I'm just gonna let your doctor know that you're refusing. And then they'll say, fine, because they don't want to get in trouble with the doctor, okay? They're fine being mean to us, but everybody's very nice to their doctors. It's weird. They want their doctor to think that they're perfect. You know what I mean? Super weird. Questions? That was a quick and easy one. Questions about any of that stuff? Mostly it's just like, don't be negligent, pay attention to the things that are important, okay? Patient consent, patient consent, patient consent, and patient identification, okay?